This is Denise. She's a professional educator who cares for Jane, who is 4 years old. Jane has recently returned to preschool after seeing her doctor for an ear infection. Now Jane must take amoxicillin throughout the day while in care. It's Denise's responsibility to make sure all the proper procedures are followed, questions are asked, and additional steps are taken to ensure Jane's medication is being administered properly. Let's see what Denise needs to do in order to follow the proper medication administration procedures. First, when she obtains medication from a parent, there are some important questions she must ask. For example, has this medication been ordered by the child's healthcare provider? Is there anything we should know about giving this medication to your child? Did your child's healthcare provider make any specific recommendations regarding giving this medication to your child? Are there any possible side effects for this medication? Has your child experienced any of those side effects? Denise must also understand the program's policy and procedures regarding administering medication and be familiar with the paperwork and documentation required for medication administration. Next, Denise will need to look at the actual medication container. In order to administer medication properly, it needs to be labeled with the appropriate information. Prescription medication must also have the original pharmacist label that includes the pharmacy's phone number, child's full name of the healthcare provider prescribing the medication, name of the medication, dosage, route, and frequency, date it was prescribed or updated, expiration date of the medication, and any special instructions for its administration and/or storage. It's suggested that the parent or guardian ask the pharmacist to provide the medication in 2 containers, one for home and one for use in the care and education setting. Occasionally, a child may need to take over-the-counter medication, called OTC for short, while in your care. In Jane's case, she's having some lingering pain from the ear infection, and her mother is requesting that she be given acetaminophen during the day if needed. Jane's mom must provide written permission allowing this OTC medication to be given to Jane while in care. Denise must check that the OTC medicine has instructions that are specific to the age of the child receiving the medication. If the label does not clearly state the dosage for a 4-year-old like Jane, Denise must request a completed permission form from the healthcare provider. While OTC medication does not require a prescription, there are still some important procedures that Denise must follow before she could administer the acetaminophen to Jane. Much like prescription medications, OTC medication must have the child's full name on the container, as well as the manufacturer's original label with dosage, route, any special instructions for administration and storage, and a clearly visible expiration date. By following these important procedures regarding medication, Denise is doing everything she can to ensure the safety of not only Jane, but of all the children in her care. She makes sure she has a complete understanding of the questions she should ask and the things she needs to be aware of before administering any medication to children in her care. These best practices are in place to keep children safe and help prevent accidents when administering medication. Way to go, Denise!